Hi everyone and welcome again to my channel Lead Your Life. Myself Dr. Monica Gupta and I am third generation homeopath of my family working as medical officer under Bihar government, and also I am practicing homeopathy for more than 15 years. With the continuation of the previous video, in this video I am going to discuss about the differential diagnosis on the basis of the fever. जिसके बेसिस पर आप जो सिम्टम्स होंगे उसके बेसिस पर आप डायग्नोस कर पाएंगे कि ये जो फीवर है ये किस डिजीज से बिलोंग कर रहा है। और बिफोर द टेस्ट टू बी हैंडेड ओवर टू यू, जब आपको टेस्ट नहीं भी मिला है, आपके हाथ में नहीं भी पहुंचा है, उससे पहले ही आप डिजीज को डायग्नोस कर पाएंगे और प्रॉपर वे में ट्रीटमेंट आप दे पाएंगे। तो आइए इसी चीज को समझते हैं, डिफरेंशियल डायग्नोसिस ऑन द बेसिस ऑफ द फीवर सिम्टम।
If the fever is with unilateral pain in chest and the pain increases by inspiration, pain aggravated by lying on the opposite side, it shows that the patient is suffering from dry pleurisy or tuberculosis. If the fever is not high, there is nasal polyp, body ache, cough and cold, and there is sinusitis, it shows that patient is suffering from upper respiratory tract infection or pharyngitis. In this diagnosis, there is fever which is generally high with the chest pain and breathlessness, and the patient has the toxic appearance. This shows that the patient is suffering from pneumonia. If the fever is moderate with rigor and periodicity, this shows that this is the case of malaria. If there is fever with the rigor and along with that patient is suffering from burning urination or difficult urination, it shows that it is the case of UTI, that is urinary tract infection. If it is the case of fever with the excess weakness, anorexia, nausea and tender liver, it shows that it is the case of infective hepatitis. There may be the case of fever with the migratory arthritis. There may be history of URTI, means upper respiratory tract infection, and ASO titer will be positive. It shows that it is a case of rheumatic fever. Patient may show fever with the acute frequent loose motions. It shows that it is the case of bacterial diarrhea. If there is the case of fever with the loose motion along with the vomiting, it shows that it is the case of gastroenteritis. If the patient comes with the evening rise of temperature plus weight loss plus cough for 2 weeks plus anorexia, it shows that the case is of pulmonary tuberculosis. If the fever is for 1 week, that is ladder type fever, and along with that patient is suffering from headache, constipation that alternates with diarrhea, and there is relative bradycardia. This shows that patient is suffering from typhoid. If the patient is suffering from fever and rigor along with there is the long bone affected, bleeding gums and platelets is also you can see decreased, that is the case of dengue. There may be fever with rash. It may show that the patient may suffer from measles, chicken pox or herpes zoster. If the case come with the fever, headache, projectile vomiting, neck rigidity, and if the Babinski sign is positive, that you can diagnose the case with the meningitis. So fever is divided into short duration fever and long duration fever. Short duration fever is again divided into 2 types: short duration fever without specific symptoms and short duration fever with specific symptoms. Short duration fever without specific symptoms consists of viral fevers, for example influenza. Under short duration fever with specific symptoms, if the patient suffers from fever along with the weight loss that is progressive, it shows that patient is suffering from HIV. And if there is throat pain, tonsillitis, pharyngitis or diphtheria, it is the case of upper respiratory tract infection. And if there is cough, chest pain with the rusty sputum, it shows that it is the case of pneumonia. There is one more differential diagnosis of the fever if there is fever with the rigor, but if there is no burning in the micturition, it shows that it is the case of malaria, and if there is burning in the micturition, it shows that it is the case of urinary tract infection. If under the fever with the long duration, if the patient comes with the abdomen pain, rose spot or bradycardia, this is the case of typhoid. If there is headache, vomiting, neck rigidity, it may be the case of the meningitis. As all you know that if there is cough, weight loss along with the anorexia, it is the case of pulmonary tuberculosis. If the patient presents with the abdomen pain along with the dysentery, it is the case of amoebic dysentery or liver abscess. If the patient comes with the symptom of cough, hemoptysis and breathlessness, it is the case of brucellosis.
सो अगर ये वीडियो आप लोगों को पसंद आया हो तो इसे लाइक एंड शेयर ज़रूर कीजिए, और इस वीडियो पर अगर फर्स्ट बार विजिट कर रहे हो तो चैनल को सब्सक्राइब ज़रूर कर दीजिएगा. सो स्पीकिंग दिस वर्ड, आई एम एंडिंग दिस वीडियो. कीप स्माइलिंग, बी हेल्दी, एंड थैंक यू फॉर वॉचिंग.